Welcome back, future nurses. In today's video, we're diving into 50 of the most critical NCLEX questions on the gastrointestinal system. These aren't your average questions, they're designed to sharpen your critical thinking, boost your confidence, and prepare you for those tough NCLEX scenarios. We'll not only cover the correct answers but also break down the rationales and strategies so you'll know exactly why each answer is right, and how to approach similar questions on your exam. So grab your notebook, stay focused, and let's get started. Question 1. A client with suspected appendicitis is awaiting surgery. Which action should the nurse avoid? A. Keeping the client NPO. B. Administering 4 fluids. C. Applying a heating pad to the abdomen. D. Monitoring vital signs. Answer: C. Applying a heating pad to the abdomen. Rationale: heat increases blood flow and risk of rupture in appendicitis. Cold packs may be used to decrease inflammation. Strategy: watch for contraindicated interventions in acute abdominal emergencies. Question 2. A client with cirrhosis develops ascites. Which nursing intervention is most appropriate? A. Encourage increased oral fluids. B. Restrict sodium intake. C. Place the client flat in bed. D. Administer acetaminophen for abdominal pain. Answer: B. Restrict sodium intake. Rationale: sodium restriction helps reduce fluid retention. Fluid restriction may also be prescribed in severe ascites. Flat positioning worsens dyspnea. Acetaminophen is hepatotoxic and avoided. Strategy: for cirrhosis, think safety plus liver metabolism impairment. Question 3. The nurse is teaching a client with GERD about lifestyle modifications. Which statement indicates the need for further teaching? A. I will avoid lying down immediately after eating. B. I will elevate the head of my bed. C. I will drink peppermint tea to soothe my stomach. D. I will avoid spicy and fatty foods. Answer: C. I will drink peppermint tea. Rationale: peppermint relaxes the lower esophageal sphincter, worsening reflux. Strategy: look for foods or habits that decrease LES tone. Question 4. A nurse is caring for a client with ulcerative colitis experiencing severe diarrhea. What is the highest priority? A. Assess skin integrity. B. Monitor electrolyte balance. C. Encourage high-fiber diet. D. Provide emotional support. Answer: B. Monitor electrolyte balance. Rationale: severe diarrhea leads to fluid and electrolyte loss, risking hypovolemia and dysrhythmias. Strategy: use ABC plus safety, circulation is compromised first. Question 5. A client with esophageal varices begins vomiting blood. Which action should the nurse take first? A. Insert an NG tube. B. Place the client in high Fowler's position. C. Check vital signs. D. Notify the healthcare provider. Answer: B. Place the client in high Fowler's position. Rationale: airway and breathing take priority. Positioning reduces aspiration risk. Strategy: apply airway breathing circulation principles in emergencies. Question 6. The nurse prepares to administer lactulose to a client with hepatic encephalopathy. What is the expected outcome? A. Decreased abdominal distension. B. Reduced blood ammonia levels. C. Improved appetite. D. Decreased ascites. Answer: B. Reduced blood ammonia levels. Rationale: lactulose traps ammonia in the stool, decreasing serum ammonia and improving mental status. Strategy: match medication with its therapeutic purpose in liver disease. Question 7. After a gastrectomy, a client reports dizziness, palpitations, and diarrhea 15 minutes after eating. Which condition is most likely? A. Intestinal obstruction. B. Peritonitis. C. Dumping syndrome. D. Peptic ulcer recurrence. Answer: C. Dumping syndrome. Rationale: rapid gastric emptying causes hypoglycemia-like symptoms after meals. Strategy: always associate post-gastrectomy plus early symptoms after meals equals dumping syndrome. Question 8. A client with Crohn's disease has a new prescription for infliximab. Which assessment finding is most concerning? A. Headache. B. Mild nausea. C. Fever and productive cough. D. Fatigue. Answer: C. Fever and productive cough. Rationale: infliximab suppresses immunity, infection is the greatest risk. Strategy: immunosuppressants equals infection risk always priority. Question 9. Which client should the nurse see first? A. A client with cirrhosis and mild pedal edema. B. A client with pancreatitis who reports severe epigastric pain. C. A client with peptic ulcer disease who reports sudden sharp abdominal pain. D. A client with irritable bowel syndrome who reports bloating. Answer: C. Peptic ulcer disease with sudden sharp pain. Rationale: could indicate perforation, a surgical emergency. Strategy: watch for sudden changes or life-threatening complications. Question 10. A nurse teaches a client after an ileostomy. Which statement shows correct understanding? A. My stool will be formed like before surgery. B. I must increase fluid intake to prevent dehydration. C. I will avoid eating bananas and rice. D. Gas and odor are not common with an ileostomy. Answer: B. Increase fluid intake. Rationale: ileostomy output is liquid, risking dehydration. Strategy: focus on major risks related to fluid and electrolyte balance. Question 11. The nurse is caring for a client with acute pancreatitis. Which lab finding would be most concerning? A. Elevated amylase and lipase. B. Decreased serum calcium. C. Elevated blood glucose. D. Decreased hemoglobin. Answer: B. Decreased serum calcium. Rationale: hypocalcemia is a life-threatening complication of pancreatitis and may cause tetany or cardiac arrhythmias. Strategy: always prioritize critical electrolyte disturbances over other abnormal but expected labs. Question 12. A client with diverticulitis reports severe abdominal pain, fever, and rigid abdomen. Which action should the nurse take first? A. Administer PRN analgesics. B. Notify the provider immediately. C. Encourage ambulation. D. Start a high-fiber diet. Answer: B. Notify the provider immediately. Rationale: symptoms suggest peritonitis, a surgical emergency. Strategy: sudden worsening plus rigid abdomen equals emergency escalation. Question 13. The nurse is providing care to a client with hepatitis A. Which teaching is most appropriate? A. You must avoid pork and seafood permanently. B. Wash your hands frequently with soap and water. C. You will need lifelong antiviral therapy. D. Avoid all physical activity for 6 months. Answer: B. Wash your hands frequently. Rationale: hepatitis A is fecal oral transmission, hand hygiene prevents spread. Strategy: associate hepatitis A equals hygiene plus foodborne precautions. Question 14. A client is admitted with small bowel obstruction. Which assessment finding is most concerning? A. Abdominal distension and cramping. B. Projectile vomiting of bile-stained fluid. C. Absent bowel sounds and hypotension. D. Reports of constant thirst. Answer: C. Absent bowel sounds and hypotension. Rationale: indicates possible perforation or ischemia with hypovolemic shock. Strategy: choose the option that signals circulatory compromise. Question 15. The nurse is preparing a client for a colonoscopy. Which statement indicates correct understanding? A. I can drink clear liquids the morning of the procedure. B. I will eat a light breakfast before coming in. C. I will stop taking all my blood pressure medications today. D. I will lie on my right side during the procedure. Answer: A. Clear liquids allowed. Rationale: clients are NPO after midnight but may have clear liquids up to several hours before procedure depending on protocol. Solid foods are restricted. Strategy: eliminate answers that contradict standard prep plus NPO safety. Question 16. A client with cirrhosis has a serum albumin of 2.0 g/dl. What is the nurse's priority intervention? A. Place the client on seizure precautions. B. Monitor for peripheral edema and ascites. C. Restrict dietary protein. D. Prepare for blood transfusion. Answer: B. Monitor for peripheral edema and ascites. Rationale: low albumin decreases oncotic pressure, leading to fluid shift and ascites. Strategy: connect lab values primary clinical risks. Question 17. A nurse is teaching a client with celiac disease. Which food should be avoided? A. Rice. B. Corn. C. Wheat bread. D. Potatoes. Answer: C. Wheat bread. Rationale: celiac disease equals gluten intolerance, wheat, barley, rye. Rice, corn, and potatoes are safe. Strategy: remember brow equals barley, rye, oats, wheat. Question 18. A client with peptic ulcer disease is prescribed omeprazole. Which statement indicates correct understanding? A. I should take this medication after meals. B. I should avoid alcohol while taking this drug. C. I may stop the medication once symptoms disappear. D. I should chew the capsule for faster absorption. Answer: B. Avoid alcohol. Rationale: proton pump inhibitors, PPIs, increase bleeding risk with alcohol. They are taken before meals and must not be stopped abruptly. Strategy: match drug teaching with its mechanism and risks. Question 19. A client with portal hypertension is prescribed propranolol. What is the purpose of this medication? A. To relieve pruritus. B. To reduce portal vein pressure and prevent variceal bleeding. C. To improve liver enzyme function. D. To decrease ascites. Answer: B. Reduce portal vein pressure. Rationale: non-selective beta blockers reduce portal pressure and prevent variceal rupture. Strategy: think propranolol equals protect against bleeding varices. Question 20. A nurse is assessing a client after paracentesis for ascites. Which finding requires immediate intervention? A. Blood pressure 88/54 mm Hg. B. Small amount of serosanguinous drainage at puncture site. C. Increased urine output. D. Client reports mild abdominal soreness. Answer: A. Hypotension, 88/54. Rationale: large volume fluid removal may cause hypovolemic shock. Strategy: watch for post-procedure complications first. Question 21. A client with pancreatitis is prescribed NPO with NG suction. What is the purpose of this order? A. To prevent nausea and vomiting. B. To promote bowel rest and decrease pancreatic stimulation. C. To prevent aspiration. D. To promote gastric emptying. Answer: B. Promote bowel rest. Rationale: NPO plus NG reduces pancreatic enzyme secretion and irritation. Strategy: no rationale for NPO in GI conditions. Question 22. A nurse is caring for a client post-hemorrhoidectomy. Which intervention is most important? A. Apply a heating pad to the rectal area. B. Provide a low-fiber diet. C. Administer prescribed stool softeners. D. Encourage bed rest for 24 hours. Answer: C. Stool softeners. Rationale: prevents straining, reduces pain, and protects surgical site. Strategy: look for interventions that prevent complications. Question 23. A client with gastric cancer is undergoing total gastrectomy. Which vitamin deficiency is most expected post-op? A. Vitamin D. B. Vitamin C. C. Vitamin B12. D. Vitamin K. Answer: C. Vitamin B12. Rationale: intrinsic factor needed for B12 absorption is absent after gastrectomy. Pernicious anemia risk. Strategy: always associate gastrectomy equals lifelong B12 injections. Question 24. A nurse is caring for a client with acute hepatitis B. Which activity restriction should be emphasized? A. Avoid heavy lifting. B. Limit water intake. C. Avoid dairy products. D. Restrict walking. Answer: A. Avoid heavy lifting. Rationale: straining increases abdominal pressure and risk of hepatic rupture. Rest is encouraged. Strategy: focus on liver safety and rest. Question 25. A nurse assesses a client with suspected peritonitis. Which finding supports this diagnosis? A. Abdominal distension with hyperactive bowel sounds. B. Rebound tenderness and board-like abdomen. C. Soft abdomen and hypoactive bowel sounds. D. Weight gain and ankle edema. Answer: B. Rebound tenderness. Rationale: classic signs of peritonitis include rigidity, rebound tenderness, and fever. Strategy: identify hallmark signs of GI emergencies. Question 26. A client is diagnosed with irritable bowel syndrome, IBS. Which teaching is most appropriate? A. Increase caffeine intake to stimulate bowel motility. B. Stress reduction may help decrease symptoms. C. Avoid all dairy products permanently. D. A high-fat diet is recommended. Answer: B. Stress reduction. Rationale: IBS is worsened by stress and certain foods. Strategy: distinguish IBS, functional disorder, from inflammatory bowel disease. Question 27. Which client requires priority care? A. A client with diverticulosis reporting mild left lower quadrant discomfort. B. A client with cirrhosis who reports confusion and hysterexis. C. A client with GERD who reports frequent heartburn. D. A client with cholelithiasis who reports nausea after fatty meals. Answer: B. Cirrhosis with confusion. Rationale: suggests hepatic encephalopathy, which can progress to coma. Strategy: always prioritize neuro changes from liver disease. Question 28. The nurse is caring for a client with an NG tube connected to suction. Which finding requires immediate action? A. Green bile drainage in the tubing. B. Client reports sore throat. C. Client reports sudden shortness of breath. D. Client complains of thirst. Answer: C. Sudden shortness of breath. Rationale: may indicate tube displacement into airway emergency. Strategy: always prioritize airway compromise over discomfort. Question 29. A client with cholecystitis is scheduled for laparoscopic cholecystectomy. Which pre-op teaching is correct? A. You will likely have a large incision with staples. B. You may have shoulder pain after surgery. C. You must remain NPO for 3 days after surgery. D. You will need a permanent colostomy. Answer: B. Shoulder pain. Rationale: CO2 insufflation irritates phrenic nerve, causing referred pain. Strategy: recall laparoscopic equals CO2 complications. Question 30. A nurse is assessing a client with chronic alcohol use. Which finding suggests esophageal varices? A. Black tarry stools. B. Severe hematemesis. C. Bright red blood per rectum. D. Pale conjunctiva. Answer: B. Hematemesis. Rationale: esophageal varices rupture cause vomiting blood. Strategy: match GI bleed location expected symptom. Question 31. A client with ulcerative colitis is prescribed sulfasalazine. Which instruction is most important for the nurse to give? A. Take this medication with milk. B. Drink at least 8 glasses of water daily. C. Expect constipation as a side effect. D. Stop the medication if urine turns orange. Answer: B. Drink at least 8 glasses of water daily. Rationale: sulfasalazine can crystallize in the kidneys, hydration prevents this. Orange urine is harmless. Strategy: focus on safety teaching for drugs used in IBD. Question 32. The nurse is assessing a client with suspected acute cholecystitis. Which finding supports the diagnosis? A. Pain in the left lower quadrant. B. Jaundice and clay-colored stools. C. Burning epigastric pain relieved by food. D. Black tarry stools. Answer: B. Jaundice and clay-colored stools. Rationale: gallbladder inflammation obstructs bile flow, causing jaundice and pale stools. Strategy, match bowel obstruction symptoms jaundice plus clay stools. Question 33. A client with an NG tube on suction develops metabolic alkalosis. What is the best explanation? A. Loss of hydrochloric acid. B. Retention of potassium. C. Increased bile production. D. Excessive CO2 retention. Answer: A. Loss of hydrochloric acid. Rationale: prolonged suction removes gastric acid metabolic alkalosis. Strategy: recall acid-base imbalances from GI fluid loss. Stomach loss equals alkalosis. Lower GI loss equals acidosis. Question 34. Which client should the nurse see first? A. A client with cirrhosis who reports pruritus. B. A client with pancreatitis with rigid, board-like abdomen. C. A client with GERD who reports chronic heartburn. D. A client with diverticulosis reporting constipation. Answer: B. Pancreatitis with board-like abdomen. Rationale: suggests peritonitis or hemorrhage, which is life-threatening. Strategy: always prioritize sudden severe abdominal findings. Question 35. A client with Crohn's disease is on long-term corticosteroid therapy. Which complication should the nurse monitor for? A. Hypoglycemia. B. Osteoporosis. C. Weight loss. D. Hyponatremia. Answer: B. Osteoporosis. Rationale: corticosteroids cause bone loss, hyperglycemia, and immunosuppression. Strategy: connect long-term steroid use equals brittle bones plus infection risk. Question 36. A client with hepatic encephalopathy is prescribed a low-protein diet. The nurse explains the rationale is to: A. Prevent constipation. B. Reduce ammonia production. C. Prevent fluid retention. D. Reduce portal pressure. Answer: B. Reduce ammonia production. Rationale: protein breakdown produces ammonia, which worsens encephalopathy. Strategy: always link protein metabolism ammonia encephalopathy. Question 37. After an esophagogastroduodenoscopy, EGD, which assessment is the nurse's priority? A. Assessing gag reflex. B. Monitoring urine output. C. Checking for jaundice. D. Assessing abdominal girth. Answer: A. Assessing gag reflex. Rationale: anesthetics used during EGD depress gag reflex aspiration risk. Strategy: always check airway safety post-procedure. Question 38. The nurse is caring for a client with suspected peritonitis. Which diagnostic result is most concerning? A. WBC count of 18,000. B. Hemoglobin of 11G/dl. C. Potassium of 3.4 milliequivalent/L. D. Albumin of 3.1 G/dl. Answer: A. WBC 18,000. Rationale: indicates severe infection and inflammatory response. Strategy: choose the value that confirms acute infection/sepsis. Question 39. A client with a new colostomy reports passing gas through the stoma. What is the nurse's best response? A. This is expected and shows your bowel is functioning. B. This means your colostomy is blocked. C. You should stop eating high-fiber foods immediately. D. You need to contact your provider right away. Answer: A. This is expected. Rationale: gas indicates bowel motility has returned. Strategy: normalize expected findings to reduce client anxiety. Question 40. The nurse is preparing to administer TPN, total parenteral nutrition. Which action is most important? A. Use a central venous catheter. B. Warm the solution before administration. C. Administer rapidly to prevent hypoglycemia. D. Mix medications in the TPN bag. Answer: A. Use a central line. Rationale: TPN is hypertonic and must be given via central line to prevent vein damage. Strategy: safety equals central line plus aseptic technique plus monitor glucose. Question 41. A client with acute pancreatitis reports severe pain not relieved by opioids. Which position is best? A. Supine with legs extended. B. High Fowlers with pillow support. C. Sitting and leaning forward. D. Trendelenburg position. Answer: C. Sitting and leaning forward. Rationale: flexed forward position decreases pressure on pancreas and reduces pain. Strategy: always think positioning for pain relief. Question 42. Which finding is the best indicator that lactulose is effective in a client with hepatic encephalopathy? A. Client has 3 soft stools per day. B. Client reports less abdominal bloating. C. Serum bilirubin decreases. D. Client's orientation improves. Answer: D. Orientation improves. Rationale: primary goal equals decrease ammonia and improve mental status. Strategy: pick the answer that addresses the main therapeutic goal. Question 43. A client post-abdominal surgery suddenly develops tachycardia, hypotension, and a firm distended abdomen. What should the nurse do first? A. Measure abdominal girth. B. Notify the provider immediately. C. Reassess vital signs in 30 minutes. D. Increase oral fluid intake. Answer: B. Notify the provider. Rationale: signs of internal bleeding or hemorrhage. Strategy: think post-op equals watch for shock plus bleeding. Question 44. A client with cirrhosis is prescribed spironolactone. Which assessment finding requires immediate action? A. Muscle weakness. B. Irregular heart rhythm. C. Mild breast enlargement. D. Weight loss. Answer: B. Irregular heart rhythm. Rationale: hyperkalemia from spironolactone can cause lethal arrhythmias. Strategy: always prioritize potassium-related cardiac risks. Question 45. The nurse is assessing a client with suspected gastric ulcer perforation. Which finding is most concerning? A. Burning epigastric pain after meals. B. Rigid, board-like abdomen with absent bowel sounds. C. Hematochezia, bloody stools. D. Nausea and belching. Answer: B. Rigid abdomen. Rationale: indicates perforation peritonitis surgical emergency. Strategy: life-threatening equals rigid abdomen plus sudden pain. Question 46. A client with cirrhosis is at risk for bleeding. Which nursing intervention is most appropriate? A. Administer IM injections in the deltoid muscle. B. Encourage soft bristle toothbrush use. C. Provide high-dose aspirin for pain. D. Administer vitamin K orally. Answer: B. Use soft bristle toothbrush. Rationale: prevents gum bleeding. IM injections and aspirin increase risk. Strategy: think bleeding precautions in liver disease. Question 47. A client with irritable bowel syndrome, IBS, reports frequent diarrhea. Which dietary recommendation is best? A. Increase spicy foods. B. Limit dairy and caffeine. C. Eat high-fat meals. D. Drink carbonated beverages. Answer: B. Limit dairy and caffeine. Rationale: both worsen IBS symptoms. Strategy: identify trigger foods for IBS. Question 48. The nurse is reviewing labs for a client with suspected acute pancreatitis. Which lab finding best supports the diagnosis? A. Amylase 30U/L. B. Lipase 900U/L. C. Calcium 9.5 mg per deciliter. D. Bilirubin 0.9 mg per deciliter. Answer: B. Lipase 900. Rationale: elevated lipase is most specific for pancreatitis. Strategy: know the diagnostic hallmark lab. Question 49. A client with portal hypertension develops hematemesis. The nurse should anticipate which medication? A. Proton pump inhibitor. B. Vasopressin or octreotide. C. Lactulose. D. Furosemide. Answer: B. Vasopressin or octreotide. Rationale: reduces portal venous pressure and variceal bleeding. Strategy: match emergency drug variceal bleeding control. Question 50. The nurse is providing discharge teaching to a client with peptic ulcer disease. Which statement shows correct understanding? A. I should take NSAIDs for pain if needed. B. I will avoid smoking and alcohol. C. I can stop my proton pump inhibitor when I feel better. D. I should eat 3 large meals per day. Answer. B. Avoid smoking and alcohol. Rationale. Both irritate gastric mucosa and delay healing. NSAIDs are contraindicated. PPIs should not be stopped abruptly. Strategy. Choose the option that reflects lifestyle changes that prevent recurrence. Great work making it through all 50 GI questions. Remember, the NCLEX isn't just about memorization, it's about critical thinking and prioritization. Every time you practice with questions like these, you're training your brain to think like a safe, competent nurse. If you found this helpful, don't forget to like, subscribe, and hit the notification bell so you don't miss our next set of NCLEX prep videos. And in the comments below, let us know which topic you want us to cover next. Keep pushing forward, you've got this, and I'll see you in the next video.